Okay, if you're going to do a flash mob dance this morning, let's get it over with. But anyway, thank you for being here this morning. This is a big event, our annual breakfast, and we'd like to talk about what's going on at HealthQuest and also our hospitals. But before I get into that, I just want to take a minute to mention that yesterday was our annual HealthQuest board meeting. And at that meeting, we passed the gavel from one chairman to another. And I wanted to acknowledge those two individuals. Steve Lant, who's been the chairman of the board of HealthQuest for the past 2 years, has done a great job. It was a real privilege working with him in the position that he was in as chairman. And I know I've learned a lot, and the organization went far over the past 2 years because of his leadership. And I want to acknowledge Steve for all the time that he put into that position. Frankly, I don't know how you did it, considering all that you had going on in Central Hudson. So I give a round of applause to Steve for the last couple of years. And also I want to acknowledge our new chairman of the board, Rob Dyson, sitting way over there in the corner. He's taken on this new responsibility. I give him a lot of credit. Hopefully you really know what you're getting yourself into. Hopefully Steve didn't tell you what it was really going to be all about. But I was thinking on the way in this morning that I wonder who woke up happier this morning. Rob? I think Steve's smiling bigger than you are, Rob. But anyway, for those of you who have not been here before and are not that familiar with HealthQuest, let me just briefly mention that we are a 3-hospital system. It's Vassar Brothers Medical Center, Northern Dutchess Hospital, and Putnam Hospital. In addition to that, we have the Thompson House Nursing Home, we have the Urgent Care Centers, Hudson Valley Home Care, and a number of physician practices that have joined HealthQuest. And we're about a $700 million operation with over 5,000 employees system-wide and about 1,100 physicians that are affiliated with our hospitals. So we're a fairly large organization as it compares to many of the organizations here in this area, but from the standpoint of the system, we're actually small. But that's who we are, and what I'm going to do is really talk this morning about the bigger picture about where HealthQuest is coming from, and Janet will then get into more about about Vassar specifically. So with that, let me start. First of all, to say healthcare is changing is kind of irrelevant because what isn't changing these days? I think everybody's in their position, in their jobs, are seeing tremendous change going on. It's certainly happening here at HealthQuest. And what we're looking at is a number of significant changes going forward as healthcare reform rolls out. And I think that's going to happen regardless of what the Supreme Court has to say. Right now, we're paid on a fee-for-service basis for the most part. And what's going to happen in the future is that the payments that we are getting reimbursed will be based more on performance than they are on just seeing a patient. There's going to be a lot more focus on quality, a lot more focus on value when it comes to how our hospitals and all of our healthcare organizations are reimbursed. Also, the care is going to be heavily dependent upon how we integrate our services and how we actually integrate ourselves, our hospitals, with our medical staff. That's going to become more important than ever before. We've got to find very creative links with our medical staff going forward. And also what you're going to see is that, and it's already starting to happen, is that you're going to see more and more care being diverted from the hospitals to ambulatory surgery centers, physician offices, and outpatient programs to try and reduce costs. So with that, our focus is really in 5 areas, and that's what I'm going to be talking about this morning, these 5 areas and how they affect HealthQuest. And that is these 5 goals are enhance quality of care, to provide greater access to care, integrate with our physicians, develop advanced care services, particularly at Vassar, and provide more effective healthcare services. And why are we doing all this when everybody else is, or not everybody else, but some are cutting back, is because, frankly, we owe that to the community, we owe that to the shareholders, and you are the shareholders. The community owns our hospitals, not our board of directors, not the CEO. The community owns our hospitals, and we are going to do the best job we possibly can provide excellent care to our communities, our owners. From the standpoint of enhancing quality of care, I think that this is a sample of just some of the awards that Vassar and HealthQuest have received over the past couple of years. And we're very focused on quality. We will continue to be. And this is just, like I said, a small sample of some of the awards we've gotten from Health Grades and others in the last couple of years. And a lot more to come as far as we're concerned. And we are one of the most awarded healthcare systems in the region. From the standpoint of quality also, I think that when you look at mortality rates, I think to myself, what better measure of quality is there than mortality? And if you look at the cardiac surgery risk-adjusted mortality rate at Vassar, for example, and this is based on New York State data, that our mortality rate compared to the other major centers around here, and even down the city and up north in Albany, far exceeds what we're seeing in these other organizations. So we're very proud of that. And it's another example of why you don't need to go someplace else for cardiac care. Also on the quality front, another thing that we measure very carefully, in fact it'll become a major part of how we're reimbursed in the future, is patient satisfaction scores. And Medicare actually does patient satisfaction with surveys they send out, and they compare us to all the other hospitals in the country. And when you look at how our patients rate our hospital's performance overall, which is what this is, you can see that the three HealthQuest hospitals in the bottom in the purple outperform not only the area hospitals, which are in green, but also both the state and national averages. And again, we're very proud of that. We plan to continue to enhance that. As you can see, there's still room for improvement, and we will continue to pursue that. From the standpoint also of quality of care, how are we providing value to you? And one of the areas that is changing is readmission rates. And you may have heard about this, but what's occurring is that the government's saying that if you're admitted to a hospital and discharged, and then you get readmitted within a certain period of time, right now we're looking at about 30 days, that we're not going to pay you for that readmission. In the past, we've always been paid for that readmission. So the way I look at this is that we're actually providing our patients with a 30-day warranty, or a 30-day guarantee. Just like you give it your car or anything else that you buy, now you're also going to get it in healthcare. So if you come back to the hospital and readmitted within 30 days of the original discharge, we're going to be required to accommodate your needs and bill you for it. Also, another big change going on is the continued pursuit of reducing the length of stay in the hospitals. Nobody wants to be in a hospital, number one. Nobody wants to be in a hospital any longer than they have to be, number two. And we do have a fairly low length of stay, but again, we're looking to continue to reduce that, because frankly, that not only improves patient satisfaction, but it improves your health, improves quality of care. The longer you're in the hospital, the better chance you have of catching something else. Also, our focus is on enhanced patient safety. We look at hospital-acquired conditions, we look at drug interactions, and a lot of the things we're doing, particularly with our IT system, are focused around enhancing patient safety while you're in the hospital. And ultimately, we want to make sure that you are much better off when you leave the hospital than when you came in. And our focus here is outcomes. Outcomes matter. Now, as far as greater access to care, which is the other item I mentioned earlier, one of the things that we're experiencing is that we do have a need for more physicians in our community. In fact, when we did a study, we found that by 2015, we're going to be looking at about 100 physician shortage across the region to accommodate the needs of our communities. And so we're going to need to address that, and we are. We are working with our medical staffs to recruit more physicians in the area. But we also, as you know, formed HealthQuest Medical Practices a few years ago. And through that program, we've been employing physicians, and we will continue to employ physicians as time goes on. In fact, to give you an example of some of the efforts we've had over the past few years, is we've added 4 general surgeons. We've also added GYN oncology, and also just recently microsurgery for breast reconstruction, and also neurosurgery. We actually employed a neurosurgeon, and we're recruiting for a couple more. And how does this benefit you? Well, frankly, it'll allow you to be treated locally, so you don't have to leave the area. And the other thing is that HealthQuest Medical Practices and HealthQuest accepts all insurance carriers, unlike some of the major medical groups. From the standpoint of integrating with the medical staff, that's very important. It always has been, but frankly, it's going to be more important than ever before. And we're looking at some creative ways in which we can integrate and collaborate and partner with our medical staff. And one of them is that we roll out a model that we're in the process of implementing to bring the medical staff into actually managing the clinical service lines within our hospitals. And that's to a degree that they've never experienced before. Who better to really understand and appreciate the issues, the clinical issues of the patients, than the medical staff. So that is underway. We're also making medical staff co-directors of our service lines and providing them with an opportunity to, again, be personally involved. And again, how does this benefit you? Well, again, it improves quality and enhances best practices across our system. As I said before, we have 3 hospitals. We want all 3 hospitals to perform at the highest levels. This is one way of making sure that happens. It also helps us to reduce costs. And it also provides us with the ability to collaborate overall better with medical staff and have better medical staff relations. So that's a big focus of ours also. Next is the development of the advanced services, particularly at Vassar Brothers Medical Center. Right now, there's about 10,000 patients a year that leave our service area because we can't provide them with these advanced services in Poughkeepsie. And we're planning on changing that. We're looking at enhancing the programs of oncology, neurosciences, vascular, thoracic, and cardiac. And the way we're doing that is we're actually in the process of forming a task force that will be comprised of the board members of Vassar Brothers Medical Center with members of the medical staff themselves to look at what are the needs of the community from the standpoint of what services we already have that we want to enhance and what services we don't have right now that we need to bring into the organization. So that's very exciting, and it'll, again, allow our community to stay here and not have to leave the area. And frankly, it'll also generate more jobs. The more services we provide, the more staff we're going to need. Okay. From the standpoint of providing the most effective healthcare services, I think that everything I mentioned so far will do that. You look at quality of care, access to care, physician integration, and advanced services. All of those will help us become more effective. However, I think that what we're also trying to do is improve our quality at the front end, so that again, we have consistent high level of care across the system and outperform everyone else. But at the back end, what we're trying to do is reduce our administrative costs, and that's what HealthQuest has been doing for the past 10 years, is focused on how to reduce those overhead costs so that we can reinvest those savings into the clinical quality side of the organization. And a couple of examples of that is our IT and administrative services. We've centralized all that over the past few years, and many others. Okay. From the, again, continuing on with effective healthcare services, I don't know if you know it or not, but we are one of the few actually rated hospitals or systems in New York State. In fact, Standard & Poor's rates us as an A- with a stable outlook, and we're very proud of that also. This allows us to access capital at a lower cost. And over the past few years, we've spent a fair amount of money on capital. And what you can see before you is a list of just a sample of some of that. We've spent over $60 million on our Monarch project. Our Monarch project is our IT systems that we brought in and continue to roll out. This past year, we've advanced significantly in that area. Also, we spent some $60 million on the medical office building and ambulatory surgery center that is under construction right now on the Vassar campus. And we will have our grand opening ceremony, by the way, at the end of next month. And also, we spent some $35 million at Putnam Hospital Center on new inpatient rooms in the medical office building. And we annually spend between $15 and $30 million a year on just equipment for all the hospitals and again, to accommodate all their needs. And frankly, there is a lot more to come. We have many big plans ahead of us. It's exciting. You know, I know that we're looking at healthcare reform, we're looking at a depressed economy, but you know what? There are still a lot of opportunities out there, and we're pursuing those opportunities, and we are feeling good about the future. Also, on these projects, you know, we are an economic engine also for our community, and to give you an example of that, the medical office buildings under construction at Vassar right now has provided or created some 200 construction jobs over the past year. And once the project is done, we will have 100 new permanent positions as a result of this new building. And also, the focus on being effective has allowed us to add additional services at some of our other hospitals, like the Center for Aging at Northern Dutchess Hospital, and also radiation therapy and the cancer programs at Putnam. And then we're also looking at some other services too, which we're looking to enhance, and that's the NICU and radiation oncology, to name a few. So, in summary, like I said, what we're focused on here are these 5 areas. Everything we do is focused around these 5 areas. And we are showing great strides moving forward. I'm very proud of the team that I have that I'm working with. And like I said before, we have a great future ahead of us. And just to recap, our goal here is to, number 1, continue to improve quality of care, provide access to care, collaborate in more meaningful ways with our medical staff, develop advanced services at Vassar Brothers Medical Center and across the system, and to provide more effective and efficient care. So with that, what I'd like to do is introduce our next speaker. But before I do that, some of you may know that over the past few months we've had a recent significant management change in our organizations. And through that management change, I became the CEO of not only HealthQuest, but also the 3 hospitals. And with that, we moved up our chief operating officers into positions of presidents of our hospitals. And Janet Reddy is the new president of Vassar Brothers Medical Center. And I'm very proud of the work that she's done so far in the last 4 months in that position. It's been great working with her. And I'd like to have her come up and talk to you about what's going on at Vassar Brothers Medical Center.